So today is a little different session. Maybe one or two more may join, I hope. We can do it very efficiently and just take Chavi's questions and then be done. If other people are also coming, we can probably see what the other person also needs. And Chavi, I really appreciate that you are going through this because we had been talking about it last year already. So how far did you come? Did you already attempt the quiz once?
Which one? The final assessment?
Yes.
Yeah, I did.
Nice.
That is how I got the certificate. Is there another one that you're talking about?
No. So your certificate is already there. So you wanted to just clarify the ones that you did not have.
Yes, especially
wrong
I was reading your messages also on the group where Harleen, unfortunately, she got bitten. And yeah, we do make such mistakes. You know, we think we'll be helping the dog. So, in fact, that's something that I wanted to clarify. Like you said, that once we complete a PEP course, we'll be protected against rabies for life. As in, if we get bitten some other time, we do not need to go through PEP again?
No, no. If I gave that impression, that was not right. Maybe what I meant to say there, immunoglobulin is so powerful, you only need that once in your lifetime. So,
oh, yeah, right.
If PAP, and PAP is post-exposure prophylaxis, a protocol, the protocol is different per situation, per individual, per case, the protocol itself changes, right? So after a bite happens, you can't say you need 2 shots, 3 shots, 5 shots. That really depends whether the person is pre-vaccinated. How long ago was your last vaccination, right? Did you have an immunoglobulin in the past? Yes or no? How deep is the bite wound? Where is the bite wound? How likely is it that this dog had rabies? So many decisions, and that is the decision tree that like a properly educated health professional should be able to interpret all these factors and ask you all these questions. I know that's not happening always in Indian hospitals.
No, it is not.
But if you theoretically wanted to walk through this decision tree, then an immunoglobulin and a pre-vaccination within so many months before the bite means that you only need to take 2 shots, is my understanding. Maybe a doctor says 3, but that depends again on how severe is the bite, where is the bite exactly close to the brain, yes or no. But 2 simple ARV shots after a bite would be sufficient if, and I say this on the basis of that decision tree of the World Health Organization, if your vaccination was done, I think 6 months prior to the bite, and if you have had an immunoglobulin already in the past. So for that, you're protected in the sense that you always will have your titer up, so you can even test that.
Yeah.
Sorry that if I connected it with PAP. PAP is a container for so many different protocols after a bite. But the immunoglobulin works for life, basically.
Yes, it does. Yeah. So the last time I got bitten was in, I think in March. I was telling you about Dobby, right?
Yes.
And before that, earlier, I don't remember when was the last time I had taken the shots, probably 2 years prior to 2026, maybe in 24, I don't remember. and I've never had the immunoglobulin. And this time the bite was quite severe on my wrist. But still, the doctors were not in favor of the immunoglobulin, and they only prescribed 3 shots. They said it's more than enough. In fact, they were not even very insistent upon anti-tetanus. They said even tetanus, anti-tetanus is covers for 5 years. Can you believe that? So,
Yeah, that can be. I don't know exactly which tetanus, what the life duration is for protection, but there are certain vaccines that even cover for life. So 5 years is not a surprising thing. I also had in the
tetanus,
past,
I
yeah,
thought anti-tetanus covers only, I mean, is valid only for 6 months. This is what we had learned since growing up, but probably there are newer vaccines, newer drugs that last for so long, though I'm not sure.
yeah, that could be that those things change,
Those
of
things might
course.
change.
Yeah, yeah.
And another thing, the PREP, you know, before just the safeguard against anti-rabies, like we were talking, like all of us caregivers should be getting
Yes.
ourselves, uh, you know, just like we get,
Pre-vaccinated.
uh,
Yeah.
yeah, just like we take vaccines for other flu and other shots. I was thinking that does that the one question that where I went wrong was if I have had prep, would that cover the bite, next bite wound also, or would I require PEP again?
So what did you think?
I said it would cover, and I was wrong.
Yeah, so there is always a post-bite booster required. If,
Yeah.
but
Uh,
only if, again, India is rabies endemic, so all doctors will take that precaution. If you go to them, they mostly say take the shots. But if you again walk through that decision tree, and I think even Dr. Balaji of the Mission Rabies said, suppose it is your pet dog who never comes outside. There are dogs who stay inside and indoor all the time, or have been outside very limited under your supervision, were never bitten, never in touch with other dogs, and is vaccinated. The dog is vaccinated. In that case, PEP is not required. So there is a decision tree which excludes, in that case, you just wash the wound properly, put it there, betadine, and disinfect it. So there are cases in which the anti-rabies shots are not required. But you cannot say, because I'm pre-vaccinated, I never need post-bites within that period. No, that cannot be said as a general rule.
True,
Yeah.
true.
I think there's someone else who's joined. Welcome,
Yeah,
Kuntal.
others have got.
And Bharti has joined.
Hi.
Hi, both of you. So Chavi was there online and she shared a couple of doubts that she had about questions, though she had already graduated with her certificate, she still wanted to clarify, which we were going through her individual questions just now. I just wanted to check in. Sorry, Chavi, to interrupt. I'll come back to you later. But
That's
Bharti
good.
and Kuntal, just checking with you whether you had completed the assessments, the final one.
No, unfortunately not. I've missed a few classes as well, so I'm yet to see the videos.
No
So,
problem. But and Bharti, or sorry, was that Bharti speaking? I didn't
nahi,
hear.
Kuntu. It's
Okay.
Kuntu.
Bharti? I can't hear you for some reason. It's your microphone, you're unmuted, but I can't hear you, Bharti. There's no sound for us. I can't hear. So, Bharti, I suggest that you join again. Maybe check your mic once when you rejoin. You're on mute. Or you can type in the chat, Bharti. Did you close the final assessment? Did you test yourself already? Okay, join again. Okay, please join again. Okay, she didn't complete the final test. Okay, now Chavi, I wanted to actually ask you, we are going to do the final test in this session with Bharti and with Kuntal.
Okay.
You may not want to stay on, but just two questions. Do you have more clarifications that you would like to discuss? That's one question.
Main question was this, and I'm trying to figure out where have I saved the questions that I went wrong on, and I can't see the pictures, so won't be able to ask.
You can go back to the final assessment, can review it, and you can then see which questions were wrong.
Achha.
Yeah,
Maybe.
you can go into the platform and log in and then see that. So that's one. The other question, Chavi, is in this session, after the final assessment we had, the feedback form, which I would request you to fill it out because we can learn a lot on how
Oh,
the
that
session.
I haven't filled. Okay, I'll
That-
do that.
Yeah, and I will share it on the WhatsApp group after this session. So in case you're not staying on today, you can do it on your own, and I'll share the link on that study
Perfect.
group. Yeah. The last question is, would you like some guidance on doing any outreach or awareness activity?
On the rabies education program? Yeah, certainly.
Yeah.
I would like help because, maybe I will falter on how to reply or give. If there are two people, somebody else with me, they can, I would need hand holding.
Yeah.
Probably.
So
Yeah.
I could even imagine that your animal welfare committee could meet once and there could be an activity there in your
Perfect.
neighborhood,
Yeah, that
something
would
like
be
that.
good.
Yeah.
That would
So what I suggest, Chavi, is if you can maybe join, if you have time, if you can rejoin after we did the final assessment today, because we will discuss all the outreach possible activities individually. So we can brainstorm with you also on your outreach ideas.
That will be around 7ish.
Yeah.
I'll try to join because that's my feeding time. But yeah,
Join a little earlier because I think we can get through a little sooner, maybe with the final test. So see if you can, and we can see that. By the way, before you drop off, Bharti hasn't rejoined. Let me check.
Kuntal has also left.
Oh no, Kuntal has also left.
Yeah.
Why? Then in that case, we can continue, Chavi. Oh, I will put it on the group and say, Kuntal and Bharti, please rejoin. Where can I say Kuntal? Not all phone numbers are showing up.
Shavi has also left the call. I was at. Oh, Bharti is here. Hello, Bharti.
Okay.
Yeah, hi.
Hi, Bharti, we can hear you now.
Yeah, I joined through my laptop.
No problem. Who is this? This is... okay. Your laptop had low battery? No, that is Kuntal is saying her laptop has low battery. So she's charging it now. Okay, good.
I wanted to ask you a few questions.
Yes,
Uh,
sure. Go ahead.
yeah, how is the situation? You are based out of Delhi, right?
Yes.
So how's the situation now? Like, have they started picking up dogs from all the public places? Like the way it's
No,
been out on the
no,
order?
no, no. So, Bharti, the picking up dogs from public places as prescribed by Supreme Court can only be done in a procedure that is also given by the courts and can only be done by the authorities that are mandated to do so. So picking up dogs from these public places in Delhi can only be done by the municipal corporation on the condition that those campuses have been identified in an inventory list, that on the campuses there are coordinators appointed, SPOCA, first point of contact, that there is a wall around those places. There has to be because otherwise there's no use, the dogs will come in again. So there has to be a secure fencing done. And once that is all done, the shelters have to be available. These dogs can never be relocated and put and thrown somewhere else. So the authorities will need to build shelters for those dogs from the identified public places. So this process has to be followed across the country. And if these preconditions are not fulfilled, there's no dog that can be picked up permanently anywhere. Only for sterilization still, for vaccinations can still be picked up, but have to be returned. So this is still the law. And in Delhi, there is no public shelter by the government run available. So they are now building a shelter in the west of Delhi. They have put the foundation stone for a permanent holding shelter. And I'm not sure what the capacity is of those dogs of that shelter, but I'm 100% sure that that is not sufficient for all the public places that have been listed. But it could be that once that shelter is up and running, that certain public places who have fulfilled all the other requirements, that dogs will be picked up from there if they insist so. There is also still a clause that management can decide that they are fine with sterilized and vaccinated dogs in their campuses, and that they take that risk that, that one example campus, I forgot the name, was it Hyderabad? That law campus. They have given an exception, but the management has to be basically put out a statement that they are fine with keeping the dogs there. So in Delhi, the authorities have not started picking up the dogs, is the answer. What happens is that illegal pickups by private catchers, so to say, is happening.
But I was reading on Instagram, like since I follow a lot of NGOs and all. So Allahabad and there's another place. There they have done this illegal picking, and they have put up the municipality shelters. They are very like unhygienic and very filthy and very dirty. And there they have captured dogs and kept the dogs over there.
Yeah. So I'm not following every town in India. I'm sorry, I don't have that data. But if it's illegal by a private catcher, then that can be taken to the authorities, and then the dogs will
they have questioned it. They have already questioned it.
Yeah, that can be, and the dogs have to be released if it's not done according to process. We still have a Supreme Court that has put a process in place that needs to be followed. But it is very tedious, and the damage is done. No? When a dog is picked up, the trauma is there, right? Okay, let's move back to the topic. Sri, Kavya is there also. Thank you so much for joining. I don't know, Kuntal had a charge problem with her laptop. She's dropped off, but she sent a message on WhatsApp, so she may join in a moment again. Sri, Kavya, did you do the test? Did you check on the final?
Hi. No, I have not actually done it. It's been a month. I finished a module, but I have not done it. I'll do it this week. I've been down with fever.
Okay, so the test we can do today together. But the requirement is that you have completed all the pre-module and post.
completed the course actually. I've completed the course a month ago itself, but I haven't done the um, main
Test.
assessment. Yes.
Oh, but that's perfect. So you are ready to do the final test today.
I am ready, but not today because first thing, I don't have access to laptop right now and I'm on the bed. Uh,
Oh,
yeah, it's a little bad this time, so I just need a little time to recover.
yeah.
I'll be doing it this week and I'll send the message in the group.
Nice. Very nice.
And I'm really
What
sorry about that.
No problem, but today's session is basically meant to guide you through the test. So
Okay.
right now, what we were planning to do was basically take a 25 minutes or 20 minutes break. Not a break, but I will be there available. You can do the test right now. And whenever you get stuck, I can guide you and help you so that you graduate. That was the idea of this session today.
Okay. Okay.
But
Uh,
but otherwise, the second part of the session was about reflection and feedback from you. I have a feedback form, which I will publish. We'll post it on the WhatsApp group as well. So you can do it later as well after the session. And the last thing is, in case you're planning to do an outreach, even if it is a small one, even if it is, just one person, maybe it is a community leader, maybe it's your neighbor, maybe it is a friend or family. How would you like to do that? Maybe you want to organize a school session. Maybe you want to do something with the RWA. I don't know. Anything you could do. That would be
right.
the last part of this session to discuss what your plans are or how can I help you and guide you there.
Yeah, so I'm hoping to listen in for the last part, especially today, because I thought I'll connect with you one-on-one. I'm also an educator, and
Nice.
after shifting to Mysore, I've been trying to get, as in my identity crisis a little bit because I'm from Bangalore and I shifted to Mysore, trying to find my place here. But at the same time, I want to see how to take it up. I have been working with a local body though, so I just thought I'll listen in and also maybe connect with you later on that particular topic. And it's not just about rabies. I try to work with children and RWAs. I've done it in Bangalore, but I want to do it here as well.
Yeah, and I really would like to take that up with you on see what these 5 steps and resources that we've developed can help you in any way. Yeah.
Definitely. The resources have been very, very insightful because, uh, unfortunately or fortunately, I've not come across a rabid dog personally. As in, I'm thankful in a way, but what I learned in the course has been very insightful.
Well, I'm happy. However, this is a course specifically focused on rabies, and Stray Buddies program actually gives support to caregivers and communities to map dogs, keep the records, have feeding arrangements in place according to the requirements as a second step, do the sterilization, vaccinations, and raise some awareness. So 5 steps are there. But I'll take that offline with you on
Yes,
how that could work for you. So
Can I ask you one more question?
yeah, and otherwise
Yeah.
I will share my screen
Yeah.
and we'll start doing the test.
You would have heard of that word titer testing
Yes.
during the vaccination process. So
Yeah.
in case rabies dogs who have been just given one shot of rabies, okay, they haven't been given the booster. Okay, and say in a city like say more than 50%, 60% dogs are already sterilized by the ABC NGO or who is working in coordination with the municipality or the Nagar Nigam. So would there be still chances of dogs getting rabid, or do you recommend that every year the dogs who have already got the shot, they should be every year annually they should be given a rabies vaccination?
Yeah. Okay. 2 questions you have asked me. First, the regime is indeed annual vaccination. So to keep your herd immunity up, and we had a session on that, module 3, it was the 3rd session. To keep your herd immunity up, you need to keep continuous vaccination rates of your population locally between 40% to 60%, which means if dogs are vaccinated once after 1 year, you do all of them at once. Say you have 20 dogs, you vaccinate all of them. Theoretically, one, imagine that this is the situation. Then next year, all of them are outdated. So your vaccination rate was 100% and drops to 0%. That is a risk factor again. After 1 year, you're back to 0. So over the course of, and it never happens that you vaccinate all dogs. Sometimes you vaccinate 5, then you vaccinate 10, then, so the due dates are also different dates in the year. So usually you have a certain percentage still up to date. Then you vaccinate the ones that are due, and then again, the percentage goes up. Keep the percentage above 40 and target 70 is what the guidelines are. One. Secondly, if a dog is rabid and bites another dog, that dog is infected. And the pre-vaccination, even if it was within a year, will not cover after the bite. So if the dog is indeed bitten by a rabid dog, that dog will fall sick if you don't vaccinate it again after the bite. You have to revaccinate it as a post-bite within, I think, 24 or 48 hours. Now the question is, how many shots should that dog get after being bitten? There are different regimes, and I think there is a problem that we don't have science. There is no proper research done on what is the PEP, the post-bite prophylaxis protocol for dogs. We know it for humans. We don't know it scientifically for dogs. And Dr. Hargun had suggested, that's why we need to monitor the dog. We need to give it definitely 1 shot and monitor if any symptoms come into that dog. We need to isolate that dog immediately before it can even start biting another dog again. This is only possible with known community dogs. If it's an unknown community dog, you will not be able to vaccinate it post the bite, and you will not be able to monitor it. In that case, you can be pretty sure if it were a dog that was bitten by a rabid dog, that dog will fall sick and will also start biting again. So we do need to have post-bite shots for a dog. Now, Dr. Hagen said within 48 hours or within 24 hours, I have to check that. You need to do the first booster after the bite and then observe. And 21 days later, you have to do a second booster shot. He basically proposed that as the regime, post-bite regime. Now, if I look online, there are different regimes, different protocols. So I don't know which one is right. Dr. Balaji says because they are not sure which one is right, some vets use the human protocol. Day 0, day 1, day 3, day 7, day 14, 5 shots. But dogs are not humans. The dog's immune system responds differently to vaccines than the human immune system. So it's very unlikely that a dog needs 5 shots. But nobody knows. So I cannot give you a concluding answer on that. But the the herd immunity before bites, keep your vaccinations up to 40% minimum and target to achieve a 70% at all times, meaning throughout the year you have to continue vaccinating the dogs that get expired with their vaccines. Is this clear? I hope I didn't confuse you more.
No, clear.
Good. So after having done all the modules, Bharti, you also had completed the modules, right? Pre-module and post-module quizzes.
No, I have to do all or everything. I have not been able to do anything.
So the question you asked right now is covered in module 3.
Yeah.
Okay. So now what do you want to do? Because you can't do the test, the final test. The test doesn't allow you to do it until you have completed the quizzes for each module. So we can go.
I I can't do the quizzes now. The time is over.
No, you can do the quizzes for, sorry, go back here. For module 1, there is a pre-module quiz, then you read the material and you do a post-module quiz. That is the system, right? And every week we have done that. Pre-module, content, post-module quiz. So pre-module content, post-module quiz is something that you need to go through for each of these modules. You can still do that. There is no time limit. You can even do those quizzes as many times as you like. If you have failed the test, you can redo it. There is no limitation. Then once you get to module 5 and you complete that one, then you're eligible to do the final test and you get your certificate.
I'll do it. I'll do it.
Yeah? Okay.
Yeah.
Once you have a certificate, post it on the WhatsApp group, then we know that you graduated.
I've been preoccupied with a lot of things, so I could not do it actually.
No, that's logical. You can easily do this if you are very dedicated, you sit down very concentrated, you can do this in 2-3 hours. If you take 4 hours, you should be okay if you do it in a very concentrated manner, but this is something that people don't usually do in one stretch. So you just take a little bit by little bit and do it over time, whenever you get time. And that's why we took this month, because it is a bit of material to work through. It's not difficult. It's definitely easy to understand, but it is something you need to work through. And today we wanted to do the final course and then celebrate with you and do some feedback. The feedback form, I will post it on the WhatsApp group. If you want to drop off for today, don't do it yet, but you can drop off at any time you like. Otherwise, if you stay on, we could even prepare your outreach activity. Once you've completed the course, you can think how you can bring this knowledge to others. And it could be informal, it could be formal, it could be in any way. So I'll just lead you through this before you drop off. This is the process for the final assessment. You have to log back into the platform. You have to go to the final assessment page, which is in the menu on the left where you find the course content. I can click on this and go and show you where you can find the final quiz. You log in, you go to certificate courses in English, you go to the Rabies Educator Certificate, and then you see on the left side the course links. Here is the final assessment. You can click on that, and I've already done it. And then you can actually review, even if you have a question wrong, like I even had that one question wrong. I wanted to see which one it was. You can review it, or you can do another. You can do 2 tests, 2 attempts. In the unlikely situation that you cannot even pass the second test, after having done your modules, I'm quite sure you will pass. Okay, but if you don't, you are panicking and saying, oh my God, I've gone through the course. I haven't received a certificate because I failed for 2 tries. And my trick is to actually create a second login with a new email ID and go again and do the final test. And I'm quite sure that you'll pass then. Any doubts that you have on questions that you did not have right, you can put it also on the WhatsApp group and we can discuss it there. Though today's session was actually meant for that. And Chavi already asked her questions just now. So I'm happy to answer all your questions if you have any. As I said, you have unlimited quiz attempts for every module, but the final test you can do only twice, and then you need an 85% score to pass it. The course material of GARC and also for Stray Buddy is on your own risk, the way you interpret it and the way you implement it. So we don't take that kind of liability in case you are, for whatever reason, giving out the wrong information, something happens, then the risk is on you or not on us, basically. That's why the disclaimer is there. So everyone is responsible for the way you pass on the information to others. And yeah, so let's do the quiz now then, Kava, Sri Kavya. You wanted to do it? We can now actually go through it. Did you want to drop off, Bharti? Just checking.
No, I'm there.
You're there? Okay, great.
Yeah.
Sorry,
I'm there. I'm there.
Fine. So let's start. Basically, you can log back in. Are you logged in? Oh, you're not doing the test
Oh,
today. In that
we
case,
have
if
to
both
log
of you,
into the.
yeah, but if both of
We have
you are not doing the test, then I'm going to actually ask you to. We're skipping the test now.
Oh, we have to log in and do it with you, right? But now
You
we
can't do
have.
it until you've completed your modules, right?
Yeah,
You
yeah, we
haven't,
can't do
so
it.
you can't do it. So we actually can't do the celebration, unfortunately. But what I had
So
planned.
do you want me to drop off the session? I can do that
No,
then in
no,
that
no.
case.
I would like you both to help me with something else.
Okay, sure.
Riti and I had hoped that we could do a group photo and a little bit of a testimonial from both of you. If you could maybe share with us something that you appreciated about this course. Would you mind, Shikavya, would you mind to have a group photo taken of the session?
Just give me 1 minute.
And would you mind to make a statement, Bharti? I can't see you. If you can maybe put your screen a little bit lower.
Now.
Yeah, now I can see your face.
I am actually in my house clothes.
That's okay. That's okay. Vritti, would you like to ask some questions about the experience that people had? You
Yeah,
can maybe
I just yes,
switch
yes.
on your video, then people can see you. That would
Yeah,
be nice.
yeah. Am I visible now?
No.
Yeah,
Yeah.
yeah. Hello,
I
hello.
would.
So yeah, I just thought that since it is the last session, so me and Anna thought it would be very nice to have like some feedback from all of you guys. Like, how was the session for you? What did you find positive? What was your experience here? Anything positive that you could take away with you? So yeah, we were just wondering to share, to be able to share that experience. Like, how was your experience being a part of this session?
So, Bharti, have you been part of the sessions?
Yeah, and see, not all the sessions. I missed quite a few sessions, but I have been following your page, Stray Buddy, from a very long time on Instagram. Okay, and so I would say quite informative and knowledgeable, and my like the way others are like community caregivers. So I am also a part of that. So helping and like the injured animals and all, especially our indies. So I'm like, I have a very soft heart for indies, not for the breed dogs that much. So, I mean, I love all the breeds, but still. So yeah, so I would say very informative and very helpful, knowledgeable, and like a lot of things which we don't know, Anna. So, so I would say yeah, quite helpful. And scientifically or terms in terms of like medically also like as a layman when you don't know a lot of things, so you get to know a lot of things, so yeah, quite helpful.
Can you give an example? What surprised you? What did you learn? Something that you remember? One example?
You asking me?
Yes, Bharti.
Okay, mainly is like about vaccination, no, the importance of vaccination, okay, and then your annual vaccination, and then how to identify rabid dogs, okay, like in my whole lifetime till now, um like that is it's like old case, so I have come across two rabid dogs till now, okay,
Yeah.
and we identified them quite late, okay, so so when they were like getting removed and they were being taken away in the van, so one died on the way, okay, and one died the next day, and to get them like caught was also like very painful, na, with the net and all, and one rabid dog had bitten my first rescued dog. She's no more. We lost her last year. So then we got her 5 shots done under the veterinary guidance. She was already vaccinated, but since he bit her, so we got her 5 shots done. But I lost her last year because her kidney failed. So she's no more. She was my first rescue, Dodo. Okay, so I would say, yeah, I mean, say learning, and I mean, still there's lot to learn, because uh, during when you come around real scenarios, no, so it's little different how to handle and what to do and how to manage the whole situation. I mean, it's not that easy. Then there's a lot of people involved, and who have no knowledge at all. Then different thought processes from different people. So, and then keeping yourself calm also during such situations. I mean, so yeah, that all is like, I would say, slowly, still learning, still lot to learn.
Yeah. Yeah, I can imagine that. Applying knowledge is also different always in practice. But thanks for sharing, Bharti. Harleen, welcome today. I just explained briefly that today is a different session than the other ones. We have planned to do the final test together, but most people who had joined, Chavi already dropped off because she had done the final test, had graduated, but had a few questions. So she got her questions answered just now. And so Srikavya also said she would do the final test, not today. So we will now do a couple of things. We would like to get your feedback, first of all, and we would like to see if we can give you some guidance on how you can bring this knowledge further to others. So Vritti was just asking a couple of questions. Harleen, I really appreciate you being there. You did the test, right? You did the final test already, Harleen?
Yes, I did
Yes.
do it.
Good. So would you mind to switch on your camera and we can take a little group picture as a final session moment? Will you be ready?
I am traveling. Okay, sure.
Doesn't matter. Yes, great. So yeah, Bharti, your face is still visible only till your eyes. Can you turn the camera a little? Yeah, now we can see you. Great. At least we have one. I think we have a group picture.
Just give me 1 second. No.
Vritti, done?
Is it better now?
Oh,
Sorry,
Vritti.
my internet is acting up a little. Just a minute.
Oh, now I can do the screenshots. Fine. Great. So we were also wondering, and Bharti already shared, what it was that basically stayed with you from this course. What surprised you? What do you remember? What will you remember a year from now? Was there some learning that stood out for you? Is there something, one thing, or that you would like to share with us, Srikavya?
For me, quite a lot of things stood out. Main thing was data, because in the first module, like the question was monkeys or the dogs, the rabies question, whether rabies spreads through only monkeys or the dogs, something like that in those lines. And I have lived my life without meeting a rabid dog, so I still believed monkeys could be the ones, but unfortunately, the data says otherwise. That was a big eye opener for me because, it was like I'm so into loving animals and nature so much and dismissing humans, not intentionally, but because of what you keep witnessing to it. That stood out as a data. It was like quite informative. And then every module had something specific and something more insightful, which kind of takes you to the journey of like trying to understand in depth, because you can just be a dog lover or an animal lover, but understanding like on the whole how it works and how it's also public health in a way where the data really matters, and you cannot dismiss or deny those things, and how to have conversation, especially if it's a group setting, how to do the talking, or if it's just one-on-one, what is more effective, depending on your what you're aiming at, what's your goal. Those were like quite interesting things which have stayed with me actually.
Nice. Thanks for sharing. Good, good, good. I'm glad. Some of you have been so attentive and so present, and I'm glad because there is a lot to learn and take away. The course materials to me sounded very basic and very simple for experienced caregivers, and still we sometimes don't know these basics. So I was pleasantly surprised that a course like this exists. So in that sense, I'm very happy to pass it on, and that's our motivation to open it up to more people. Yeah. So I think Raj, you've also joined, right? Raj, we have a different session today. Would you mind to share your video? Yes. Oh, fantastic. We wanted to have a little bit of a group picture taken, if you don't mind. I think Fritti is taking a screenshot. Raj and Harleen, both of you, I don't know who wants to go first, but could you share with us what was a remarkable lesson learned? What surprised you? What was new? Something that you would remember from this course? Harleen?
Yes, hi. So for me, once again, like Shri Kavya said, the data. We are very quick to dismiss dog-related data, how dogs can be culprits in this whole system, the spread of rabies. So this data was an eye-opener, and also the whole ecosystem is quite related. Reading, understanding a dog's body language, awareness of how you can minimize dog bites, everything is correlated to one another. Also, I have been getting a lot of street dogs vaccinated, about 200 of them, like yearly. So this has reinforced my own belief that what I'm doing is really good. So that's about that. Basically, the statistics and the data. Very shocking. Very shocking.
Great. Yeah, absolutely. Thanks, Helene, for all you do. It's amazing. People like you. Stray Buddy was really started as an initiative to help people like you, individuals, to bring a support system to what you do, and maybe help to bring these processes a little bit further than the individual work that you do. But I think, how was your bite incident, by the way? How are you doing?
The wound healing will take some time. It was actually a very bad because I'm better. I'm not in pain. I have been given painkillers by the doctor. The immunoglobulin, I think, because I was extremely panicked, I went there. There was bleeding from both my hands. I think that was the reason why the doctor gave the immunoglobulin. But now I know, of course, it did nothing. It did nothing to my case, because I have been vaccinated against rabies just very recently as well. I was scratched by a stray cat, because I'm very hands-on, very much on ground with dogs, cats, even cows. But I think the doctor also panicked, perhaps. That's why he gave me the immunoglobulin. Now I know much better. Now I've read the whole chart again. I read it because my life depended on it. I read it very, very, very well. Went through that tree, saved it. I'm going to share it only within very small rescue groups where people know what they're doing, not with the general public, because they are not going to benefit from this chart.
Absolutely, they may even panic also.
Thanks for asking.
No, absolutely. Actually, an incident like this is only an opportunity for learning also. Right? I wish it didn't happen, because it's a lot of pain. So I wish you well.
It's okay. It was my fault. I have learned from it. The dog wanted to get away from me. I went towards the dog. It was it's a learning lesson for me. So that's that.
Yeah. Great.
I
Good.
want to ask one more question. I have another
Yeah,
question.
but before you ask, is it related to this topic or something else?
It's related to
Okay,
rabies,
so
but
please come in.
vaccination in humans.
Yeah. Okay, please come in. Yes.
Okay,
Please ask.
so say in case you are feeding and all dogs, okay, your community dogs, and sometimes there are a lot of dogs who are very hyperactive and they're very excited, right? So what happens is like they'll climb on your shoulder and all, and then little bite, this not saliva, little like scratch you might get on your hands or something, or maybe the shoulder or the arm or something like that. But say that person is already has taken an vaccination shot for anti-rabies and tetanus. So we have a feeder over here. She always gets very scared when she gets a little scratch, and then she'll every time go and get the shots done. So like very frequently she did 3 months. So is it advisable to take shots so frequently?
So again, I'm not a doctor, but again, from what we have learned, and I just take the course materials and all the information that we've that we have access to. First of all, a shot pre-vaccination is a good idea. So that will last for a year, and then you would need to have your boosters. In case you get bitten in between, you always take your post-bite shots as well, right? If you're pre-vaccinated, immunoglobulin is not required, but you still need a minimum of 2 shots, okay? But this is also, again, very case by case. If a dog is known to you, is pre-vaccinated, and has not been in touch with other dogs, which you don't know, and outside dogs may be in touch with other dogs, right? But if it's a pet dog, you know it. But if these are outside dogs, if they're pre-vaccinated, you know their history, they did not have any bite wounds, they had no injuries. How can they be rabbits, right? So that's one. Secondly, if it is a situation in which the bite was actually, in this case, it's not even a bite, it's a scratch. It's a playful, excited, kind of a welcoming greeting when they jump up to you because you have food. They know you, they're playful, they want your food. This is what they do. Maybe you have maybe even taught them to greet you that way without knowing because you're encouraging that behavior, right? So they don't know that they're doing something wrong. They've even been trained without knowing, trained to do so. That is not an unprovoked bite, right? It's not unprovoked by the sense that, oh, I walked by, I had nothing to do with this dog and it came out of nowhere and shot and bit me. Unprovoked. In that case, it could be a rabid dog that basically just bites anything and everything around it. That's an unprovoked bite. Those are risky. Even the bite of Harleen, I was not there. I can't judge whether it was a provoked or unprovoked, but it sounds like you provoked the dog. It sounds like that. If you provoke the dog and the dog is giving you signals that dog doesn't like that proximity, doesn't want it, and you disregard, you continue and continue. I'm not saying, it happens to everyone. Huh? There's no judgment. Then the dog feels no other way out than to say, snap, go away, distance, I want space. So it is a provoked bite by us. We provoked the dog, right? That is a different situation. Very often, those are not rabid dogs. Those are just normal communication. Dogs will communicate and the communication fails or it escalates, right? And if it's a playful thing, it's a scratch, it's not even a bite, right? Then, these are gray areas. I cannot say yes or no, you need to take the shots because it really depends on every case by case. But it sounds like that person is getting over vaccinated. Also, titer, you could actually ask this person to test titer for rabies in their blood. There are special blood tests that you can do. And if the titer is up, why would you get another vaccine?
We told her, but somehow psychologically she was so scared and she wasn't getting convinced. Then we had to leave her on her decision.
Let her do
say
this
much.
course. Maybe another option is to ask her to say, here is a course you can learn about what is a rabbit dog, what is not, what is the regime, how to do it. Maybe
I've
she wants
tried
to.
that with her, but I've tried that with her. Then, I mean, only into feeding and all. She doesn't want to go beyond that scope. So
Yeah,
can't force her
I
much.
meet people like that a lot. So in that case, there's hardly anything you can do for them if
Yeah,
they
we
don't want
can't
to
force her
learn.
much to
Yeah.
get a little more educated. I told her to read and all,
Yeah.
but then she was like little
Yeah.
reluctant. So then I had to leave her at her own choice. I mean,
Let's
I could
see
not do much.
whenever you get an opportunity again to keep saying
Yeah,
it.
maybe her
Send
mind
her the chart.
changes.
Send her the WHO chart, maybe as a decision tree, specifically to her only, and say, this is one of the resources you can look at. Like that. Just keep
Yeah,
nudging. But yeah,
yeah,
it's
yeah.
better safe to be safe than sorry. So I also don't want to discourage people in certain situations. You should take the shots.
But again, for the titer testing which you are saying to get it checked, whether the vaccine titer is up or not all hospitals would have that specialty available, no?
No, not all hospitals do that. No, you need to find out which lab can do that. Yeah.
Yeah.
Okay, so thank you for sharing, Harleen, and all of you. Raj, may I come to you? Is there anything you would like to share with us about the course?
Sure, yeah. So the first three modules were pretty easy for me. Like I could just brush past through it because I knew about all of this information already. The most interesting module was the fifth one because that is something that is crucial for people who are into the educator side of it. We should know how to talk to people. We should know how to make people more be more interactive with you, like as it is mentioned there, how to be a good communicator. And I think this is something that I'm taking with me. I have a few sessions lined up regarding not just this rabies welfare, but also general animal care and welfare and so on in a certain colleges from the next week. So I'm definitely going to use these things because I think this is where most of us are actually pretty ineffective. We have all the information, we know what to say, but we don't know how. So most of the issues in the world are because we don't know how to say it. What and why is always clear. How is always the problem. How to communicate the information. How to deal with people. How to not be more emotional when the other person is already expressing it that you know what तुम्हारा कुत्ता ये करता है तुम्हारा कुत्ता वो करता है and you could be like नहीं तुम ही problem हो तुम्हारा ही problem है and it just goes on to a back and forth and then in the end no one wins and the dog definitely loses. So the fifth part is what I enjoyed reading the most, and I actually completed it just today and it was super fun to do. So thank you so much for that.
Yeah, most welcome. I'm also glad that you brought that forward because most people are here for the technical information. And as I said, it's a very basic course. Still, we can learn from the basics to get that right. But how to bring it across to others. And just as a reflection, in those emotional fights or argument situations, are people open to listen to any information that you share with them?
So most of the time I do is I just be a good listener. So if someone is really going to yell about dogs, I'll just be there. Okay, what's your problem? अच्छा ऐसा हुआ आपके साथ. Okay, how can we make it better? Because आप like you stay here, you're going to be with the dog every day. Then the best thing that they would say is what, take the dogs away. I'm like, okay, that isn't possible because that is not legal. What is the next thing that we can do? Then they come up with, okay, if you don't take the dogs away, then we'll kill the dogs. Then I'd be saying, okay, that is illegal as well. And now that I know that your intention is to kill the dog next, I'll be, very much I watch that if a dog dies here, we'll definitely come to you asking, what did you do to the dog? But let's find out a better solution for that. Maybe is the dog neutered? And they would say, oh, no, the dog is not neutered. It's like, yeah, that's the problem. Because if there's an unneutered dog and there are females around, a male dog is going to be aggressive because he wants to mate, and the female dog is going to be aggressive because there are all the males charging on her right now for the next 10 days, 15 days. it's going to be a very hard situation. Does the dog have puppies? If there are puppies, then you should definitely not interact with the dog if you don't know the dog. Is the dog vaccinated? Oh, you don't know the dog is vaccinated, then that is a problem. Who is the feeder here? Have you talked to the feeder? Then most of the time it's like, yeah, we talked to the feeder. She is a very, arrogant lady, does not talk well with us. Like, okay, no problem. Give me the number. Let me talk to the feeder, get the information, and get back to you. And if the dog is not vaccinated, we'll ensure that we coordinate with her or him and get the dogs vaccinated. And so it will help both of us. In case of any further issues, you still have my number. You feel free to contact me.
Yeah.
This has helped helped us so much in Goa, because in Goa, most of these people have such problems.
Yes.
They only have these problems occasionally. It's not an everyday problem. It's once in a year, twice in a year problem that they're going to have. And that is the time the whole society is going to come up with this. If you can just manage those few days, I think most of the people are pretty ignorant about dogs being around there. They're just like, okay, let the dogs be there. If they're not harming us, we don't have to worry about it.
This was fantastic that you took us through a conversation that you may have potentially. Yeah, because there are different ways of having such conversations, and sometimes these conversations itself escalate and have absolutely no benefits, right?
Yeah.
So in those situations, it is sometimes better to step back and come back another time, right? So
Absolutely.
that is also a tactic. But thanks for sharing that. That was very helpful. I think everyone here on the call has shared something very valuable. And I think we should continue also to support each other and help each other and learn from each other. At least the next month, I'm keeping it open. And Raj, your sessions that you're going to plan, can you share a little bit about, what is it that you're going to do? How are you going to do it? You don't need to give a report to us, but even, just a couple of short bullet points or something that you wanted to share on a program that you have designed or something can inspire somebody else to do something in a college as well. So yeah, whatever any one of you is doing this month, or anything you're planning or have ideas about, please do use that group. And even if it's only 4 or 5 people who are active, doesn't matter. A lot of people are even there just passively, but looking at it and may get an idea as well, right?
Absolutely. Yeah.
Thanks for that. I just quickly go back to sharing my screen and continue with the plan for this session. Those who have graduated, congratulations. Okay, this was coming back. In your registration forms, you all put motivations in for the course, to do this course. I was just checking in whether, and these, I grouped them all. I mean, there's a lot of motivations. Some people wanted to just have knowledge and understanding. Others wanted to do advocacy and system change, even very high ambition, be part of the solution. All of this, curiosity, lifelong learning, personal growth, all of these things. Anything that you have had as a motivation or a expectation which has not been covered, or anything that you wanted to share about your motivations about this course? Just checking in whether it was fulfilling your requirements, or if you have a need for more. Yes. I don't know what this is. Please, you can unmute yourself. Yeah.
So, as you already said, this was a basic course. So, pretty much it covers everything that a basic rabies educator should know. One thing that maybe we can develop a course upon somewhere in the future is about how to work with the government, how to work with your local government, and how to get these things be implemented as a policy. Because as individually, as a group, we can only do so much. But when we can directly involve the government into helping us with this, it can actually have longer benefits, and can reach to more animals than possibly a small group can. So
yeah,
maybe we should build a course around it.
Okay, good. Working with the government. Dr. Asher is doing that, who was on the last Q&A session. So thanks, Raj. Good tip. I think we could bring that to him, see what he says. the next course on the GARC platform that you can now, so I'm just going to move here. If you want to learn more, Raj, this is these are a few more courses, right, on the GARC platform, which are free, and you can only access them. Like the community coordinator course is a very useful course, again, very basic, but again, the basic knowledge in a very structured manner can still give you a lot of insight. So community coordinator for rabies is a course where something that you probably already do, and I also have been doing it in the communities, is help them to organize their vaccination drives. And I never thought about the fact that I should involve the community leaders in this process. So we are doing it. We are just doing it. We are getting a caregiver. We're vaccinating a dog. We don't even take the records. We don't even put these stickers anywhere. And even if we do it for our own benefit. We keep that record with ourselves so that we know next year this dog is due. Okay. But other systems that we can share all of this with, it makes the society feel safer if we make this known to the world that we have achieved 50% or 70%. So how can we make this known to the world better? How can we make it visible that we've made the society safer? That these dogs are not a risk for rabies anymore as much. How can we work with the government and involve them even in what we do? We do their task. We literally vaccinate dogs, whereas the government should be doing this. Right? So how can we work with the government? I think involving the government stakeholders in the fact that we're doing it, just informing them is already something that we mostly forget to do. Right? So the community coordinator course also says, like, involve your community leaders. And who is your community leader? Identify them. Like, I would suggest, Raj, that you do that one. It may not give you all the answers, but take that one also, because then you'll get a bronze dog health champion badge. So you are, becoming a GARC, like, level up. If you do these 2 courses, you get another badge. And if you do 2 more courses, you get a silver badge. But you can do only this course after you've completed the Rabies Educator course. That is the basis for the next courses. How do you apply for this? You need to not re-register. You can use your same login. But you need to request for a code, a key. So you need to go there, and there is an email somewhere on the right. You see that form, email, first name, last name. Fill that out, and you'll get in your email, you'll get a key. That key you will need when you want to open the course content. It will ask you for that code. Okay, so that's how they have protected the fact that you first need to complete your certificate for your Rabies Educator course. Okay, so that's on that. I wanted to ask all of you to take 5 minutes max to complete this form. And Vritti, can you help me? If you can post a link to the form.
Yes, just share it.
Yeah. Could you all take a couple of minutes? It may not even take 5. It may take 2-3 minutes. Yeah.
Yep,
the link is in the chat. You can click the link in the chat, and it takes you to the form. It'll help us to improve this study batch for next time.
I've shared it in the chat.
Thanks, Preeti.
How can we access it? I'm not able to access it.
Do you see the chat in the call itself? Here is a chat box in the video call, where you can also enter or ask questions, Bharti. In the call, in the video call itself. I will also post a link. Vritti, can you post a link on the WhatsApp group also?
Yes, just doing that.
Yeah.
Okay, I think from here. Got it. I got it. Thank you.
Great.
Got it.
Welcome.
Also, just one question I wanted to ask, like, would everyone be fine if we can use these videos and photos for our social media?
Yeah.
Sure.
Thanks for asking, Riti. So whenever you're done with the feedback form, you can leave a note in the chat that you're done. Good. Great, Helene. Thanks. Helene, are you planning to do any outreach activity?
Yes, I intend to have a session with my facility office of the society. We have, unfortunately, 3 more new dogs in the society. So I need to talk to them about, because this is something I've been doing silently myself. I get the dogs vaccinated. I keep the records for my own self. Whenever there is a bite-related incident in the society, I quietly send the family the record of vaccination, and then the whole thing is put to rest. Otherwise, there's a lot of anger in the society. They want the dogs out. So, but I want the facility to own up to it. They have to be a part of it. They need to understand the significance of it. They need to understand that we share our environment with jackals. We have we are in a very close proximity with some jungle area. So it's very important for them also to take the onus of vaccinating the new dogs. So I will be getting in touch with them, scheduling a session.
Sounds very good. If in case the Stray Buddy tools of keeping records online and visible for everyone in society on the percentages of sterilizations and vaccinations achieved in your area, sometimes that makes an impression, feel free. I will create a section on the website for your area, and you could also create those online records there. And I can lead you through it. Even Sri Kavya was interested. So even the two of you, I could schedule a separate call with you and lead you through these 5 steps and see which tools are useful for you to use in this process. The idea there is actually of Stray Buddy is that an RWA owns this, how do you say that? Owns the process in terms of, I asked my my RWA to set up an animal welfare committee so that the welfare of the residents would also be improved. And ultimately it took 2 years, but they did. And that gave me a lot of backup and support. They've never been able to pay from the funds from the RWA. That was a bit of a problem, finances. But apart from that, we've tested this in other areas, and that was very helpful. So that ownership will come. Also, if you create records, you can show these are whitey, brownie, kalu, whatever you call them, and they're vaccinated and sterilized. And we got the children to make posters and design posters, and we hung them up and say, call my name and I'll be your friend. Like that, it becomes a neighborhood's woof, and non-human residents, like things like that. So these tools and ideas are there. If you wanted to, you can make use of them.
This will be great. what I have been doing for my society is I make calendars every year with the photographs of the dogs with their names, cute poses. I gift it to the facility office for display. They hide it somewhere in the back. We also have insisted on a committee, which I am a part of. But again, we are the most neglected. We don't get to know any matter. So there's a lot of resistance from my society members. The RWA, they just don't want us to do anything with us. They want us to be right at the back, stay there.
Yeah. This is a very sensitive topic. I hope the course gave you a little bit of positive messaging and things like that. And the same, I hope that I can give you from the stray buddy experiences, and it's never a rosy and a simple and an easy journey. I agree with you. But whatever can help, see if there's anything that you can take from it. That's all I can offer. So good, everyone is done with the feedback form. So yeah, Raj is going to do outreach, already has an idea. Harleen is going to do that. Harti, I think you said you wanted to talk to a few people. So if you are doing anything, please take pictures, videos, share them on that WhatsApp group, even your ideas and even your plans, so that others get inspired. If that's okay. So I actually, we've come to the end of this session. I would just wanted to thank all of you sincerely for your commitment to this course. And also the Global Alliance. I've mentioned that I've been doing these study badges and they were very appreciative. So also on behalf of them, post your certificate on the group if you haven't done so. We'll keep the WhatsApp group open for another month, or at least until the end of August, so we can help each other. So I wish you good luck with all your activities. If there is anything, now you can stay on for a little bit more. If there's anything you wanted to discuss right now still, others may drop off, but if you want to plan your outreach and go through a couple of these questions, or if you still have a technical question to ask, feel free to stay on for a little bit. But otherwise, I would say thank you very much for being there today. And let me know if any one of you needs more targeted and customized help. You can DM me, you can email me, or you can put it on the WhatsApp group anytime. Who wants to stay on for a bit? You can raise your hand. Or anyone else to get some guidance?
Thank you so much. I just need one help regarding the stray buddy thing. So maybe if there's a session planned somewhere about it, then we can connect on that.
And what is it exactly that you would like to know about it?
So basically, I was talking to my folks here who do regular feeding and vaccination and everything about the dogs in the community. We have a huge place. So there are about 200-250 dogs in the whole area that we take care of. So I was pitching them the idea that we can use stray buddy to maintain records and everything of these dogs, when they were sterilized, when they were vaccinated, when they're next due. We can track everything here. But the question that they had is, and even I'm a little confused here, was this platform, this has to work hand in hand with the RWA themselves, or how does it, or can individuals just maintain it?
Yeah, you can use it the way you like. If you're organized as a caregiver group, you can request us, just, you know how to find me now. You can request us to create a section here for your area. If you have a specific area that you are working in, or even multiple smaller areas, we can create a section here on this website, and I will lead you. I'll give you a login on this website. This is an app, the web tool. You can get a login access, and then through the dashboard, you can create new dog records for each dog. So that is what you can do. This is independent of the RWA in that area. Sometimes it helps to have that RWA on board, and sometimes they don't want to come on board, and then, it's very difficult. Sometimes it also helps if you have mapped the dogs already and then show them that this is how much we've done. We've worked on sterilizations, we're now working on the vaccination. See, these dogs are all due now. So, so you can say we annually vaccinate them. We are going to do a campaign again because we've dropped below the threshold. Could you help us with, that's only, I don't know what your question is to the RWA. You could request for an animal welfare committee to be set up and say, we use this system and we track everything, but, we want to make it more visible. And you can use this in your conversation, this tool, once you've mapped them. It can be useful. The other thing we do is we create, here you can see this thumbnail, for example, we create these dog territory maps with Google Maps. You can even do that without StrayBuddy. You can do it yourself. And if you wanted to have a feeding system in place, in some areas, they appreciate feeding points to be appointed. The biggest mistake you can make is make one feeding point where no dogs can go because they crisscross each other's territory, right? You get more dog fights. You get likely more irritation, you get more restless and stressed dogs and potentially bites. So feeding is directly related to that also. And therefore, if you make a territory map, as a caregiver, oh, these 3 dogs in this lane, they are friendly together. Those can be fed at one point at the end of the lane when nobody is disturbed. We can easily take these 3 there. But those dogs there need to go to another point. They can't eat together here. So you circle, you basically print this out and make a circle and say these 5 dogs can be fed together. And then for those 5 dogs, you can find a place that suits everyone, the caregivers, the feeders, as well as the residents that are not disturbed, in a place like a little away from the entrance, a little away from the children's playground, according to the law, right? So these territory maps are very useful as a tool. Again, this is not specific right now for StrayBuddy. It's just the method that we take you through if you wanted to. We give you these tips and suggestions on how you can do it. And then, for step 3, 4 is vaccinate and sterilize, which you now know mostly. And awareness. We have a lot of awareness activities on the website also. Haven't updated the resources pages much in the last 2-3 years. I'm right now going to update them. And on the awareness, we're going to put a lot more ideas and flyers and information because this is all pretty basic. And these are real life examples of kids' activities and things like that we have done. So it's unique material that we posted here. These posters have been very effective, for example. Yeah. We also have templates in Hindi. But kids love making them. They all work with Canva or with Instagram, and you ask them to put certain information on it. Say you need to at least put this information, and then they're free to design it. And you do a little competition. Say you can put your name on it. We print it, and you'll see the poster hanging in the neighborhood. They're very proud to see their name there. These kind of things you can do.
How many people can get login to, let's say, one area?
Unlimited. There is no limitation.
Okay.
Ideally, more people because everybody knows their dogs best. So I would not centralize it because then you are always chasing the information. If people are saying, yeah, I own my record, that's the best. Sometimes people are not tech savvy or they don't have the discipline and they say, you please do it. And then you can appoint one of the or two people, ideally not one, as the coordinators for the data and ask them to keep it up to date every time when you do a drive or when you vaccinate a dog, or we deworm the dogs also a couple times a year. We update those records as well, the dates. It's not even difficult. It takes like less than a minute, 30 seconds once you logged in to update one dog record with the dates. It's not a perfect tool, by the way. We're also thinking of expanding it and making it much more user-friendly, but we don't have the funds right now. So that's foreseen in the near future.
Is this tool free or do we have to pay
Yes,
something?
it's completely free right now. Yeah.
Okay.
Yeah.
All right, thank you. I'll go through this complete website once, and if there's any more questions, I will definitely pick you.
Yeah, and remember the website is a little outdated, so if there's anything unclear, let me know. And
Sure.
that will help me to also realize that certain pages need to be rewritten, because there's a lot of text also, and it can be. So yeah, just help me also to say, I can't understand this. Is there any, whatever. If you come across anything, I'm totally open to improvements and suggestions and feedback.
Sure. I'll surely do.
Can I ask you one more question?
Yeah.
Like, since a lot of rescuers, caregivers, and NGOs, like, they're focusing on adoption, but the adoption rate for our indies is very, very less. What do you think? Like, what different can be done to convince people like they can adopt more indies, so we can get, like, if more population gets off from the streets, we'll be like,
There's so much to say about this party. We had a whole, every month we do a cafe, Stay Buddy Cafe. We take a topic, one topic, and it is actually recorded. I think it's on YouTube. There was a lady who is actually helping people with adoptions of indies. And that lady was giving a very systematic and structured approach of how she goes about it. It's not easy. It's very difficult. But that is one that I can maybe share the link of that recording with you. And she also made a little document as how she does it. So it's a text document that I can share with you. The other thing that is interesting is I'm just thinking about a couple of things now. My first question is, why would we take all these dogs off the street?
no,
That's a
not
very
all
good
of
one.
them, but see, not all of them. See, if you think it from a different perspective, mainly from the sickness point of view, okay. Recently, there's a dog. Her name is Julie. Okay, so she was sleeping beneath the car. Okay, and the driver did not check, and he passed the whole tire from her hand, the front hand, left side, and to the stomach. Okay, and the hand is broken. Now the doctor has done the surgery and he has put a rod in it from 3 points. The whole bone was like limping, and then she had a lot of injuries, and luckily her stomach got saved. The urinary bladder was not affected, because I've seen a lot of dogs who die because their bladder gets affected. They're not able to poop and pass urine. Now the person who has hit him, he is the driver of an IAS officer. Okay. So we reached him out, like, if he could help us financially. So initially he was like showing very concern.
So, Bharti,
And
sorry to
then we
interrupt you,
tried.
but I have to keep this session a bit short. On the adoption
Yeah.
question, if you talk about rescues that are even medically
No,
impaired,
my concern
it's
is
very
if
hard to
they get
find.
adopted. Yeah,
Yeah,
if they
but
get adopted, they
you
are
know,
off the streets, and we can save all this.
yeah, but okay, you mean healthy dogs off the streets. So there's a
Like,
whole
once,
body of work on whether free living dogs are homeless pets or belonging to an urban ecosystem and fulfilling a role as a species and belonging out there and having freedom of choice, freedom of agency, living the natural dog life that a pet is in a confined area in a home not able to live. A pet in a home has a nice bed, has a lot of love, has food, but that dog is dependent on the owner in every single step and way. When it pees, where it pees, when it poops, when it eats, what it eats, where it sleeps, how much it sleeps, everything. How many cuddles it needs to endure without even snapping. I mean, that pet is a teddy bear, has become that one. And there is positives and there is negatives on both sides. Injuries, yes, we want to protect all these dogs. We don't want to see these rescues because of these accidents, the risk that they run. Yes, I understand. But what is the positive if a dog gets fed outside, has food, has water, has a little care, level of health care, of preventative care, has known people, is free to go to the chai wala, is free to go to the press wala, is free to go to this house, get some milk there. This is a dog who lives a life that dogs for millions of years have lived, right? Now, unhealthy dogs need help. Yes, incidents, rescues need help. But healthy dogs, do we all really? This is a question to ponder about. Yes, there are puppies who need help because mom is no more there, right? There is a lot of situations where we need indies to be adopted. Yes. And so I wanted to say there is another successful young people initiative. They call it the Possum People Project in Coimbatore.
Yeah,
In
I've seen the
Coimbatore,
page.
yeah, they're in different cities now. They've spread over different cities. They have done a lot of campaigning on indies. There's social media campaigning on indies. Indies are very good dogs also as pets, definitely. And then the procedure on how to adopt, as an Animal Welfare Board of India form. Even if you adopt a dog from the street, you need to know that those people are not going to release it again on the street, right? There's a little bit of a form that you would like to. So there's a lot of resources out there, and it depends on what you need, and it goes beyond today. So if you if you want to know any of these resources, I'm happy to share bilaterally with you. Just DM me.
Sure.
We talk further about it. Yeah.
Yeah.
Great. Can I ask anyone else to again? Do you need any guidance today or later on your outreach activities, Shrikavya? Yeah.
Yeah, I just, it's okay, I'm sorry. Sorry. Her friend is out for a walk, so she's missing him.
Someone needs attention.
He's out.
Oh, hello.
Yeah. So I would like to talk personally because I am on a break. I just finished my fellowship with the Ahimsa Fellowship in May, I believe. And like right now, I'm trying to strategize and see how I want to continue this journey because this also needs a lot of more armor around to tackle the conversation and communication because at times I'm just human, you know. So just taking my time to ground myself before I continue this journey. But my main idea has always been on education and awareness, and it's been, as in I'm in a new city. Earlier, at least I was in Bangalore, so I could just go head on. In new city, I'm just trying to find my place. My idea is to work with the local body. That's why I'm in touch with them. I keep going and show them my face, check in what's happening and stuff like that. So my idea is more on education and awareness, and of course, rabies being a public health concern. This is a wonderful thing. So when I saw this, I'm like, okay, I want to do this course. That's why I sat down and I just didn't realize. I just went module by module, and I forgot. Okay, I've done so much, but the study sessions were meant for it and stuff. So I would like to connect with you in some time. Maybe this month after Independence Day or something, so that I also plan myself where I stand, how I want to go about, and then connect with you because I'm connecting to people as well here. I liked your mapping system of the community dogs because that is like really essential. I feel so. I have a lot more to connect with, just like how Raj was mentioning. One of the thing was the community mapping which you have done, which is very fantastic. It's basic, you say, but it's really good. So I just need some time to gather myself together and connect with you 101 at some point. At some point.
Let's do that after 15th then. You just check in with me and we fix a date. Happy to do that.
Yes. Thank you so much.
Welcome, most welcome. And also, if you wanted to learn more, take that community coordinator course. And
I would like to.
Yeah.
I would like to. I had planned, so I will, but
Then,
one thing at a time.
Yeah, one thing at a time. But I just wanted to encourage you because it's not difficult. It's something that you've probably already done. And it's something that gives you a little bit more of a feel like, oh, okay, I'm doing the right thing, or oh, okay, I didn't think of that. I can actually build that in, and it gives you some inspiration. Yeah.
Yes, definitely.
And it gives you the badge. It gives you also a status if you talk to the authorities.
I realized that, yeah, because I felt okay when I go to the local body during the meeting or say I want to talk about this, that kind of changes
Yes.
how they would approach or how they would see me, then they would understand I'm not just a dog lover or animal person, something like
Yeah.
that. They understand I come from public health or community work, something
Yeah.
beyond dog person,
Yeah.
and that approach
And
is
if you
kind
say I have a a status as whatever with the Global Alliance of Rabies Control, right? So that helps.
yes, yeah. That's what something which made the difference in my head as well. So yes, I'm thinking of that. I'll do that.
Wonderful. Good.
So nice connecting
Anything
with you,
else?
and thank you so
Yeah.
much.
Welcome, welcome. It was a pleasure. I really enjoyed it. Without you guys, I couldn't have done this, right? It's the interaction that makes it interesting.
Yes, and you've been very patient in taking up everything and extending your time.
Oh,
It's really, as in you're a kind of mentor which one needs, yeah, because
I'm
everyone in animal welfare has become a cuckoo in one one way or the other.
everyone needs a mentor. I am glad I could do a little bit for you. I have other people that I lean on. Everyone needs to support and help each other here. So
Yes,
yeah, happy to have
that's
done.
how the movement can go ahead, that's the point.
Exactly. Yeah.
Yeah.
Great.
Yeah.
Okay, we'll remain in touch, at least through the WhatsApp group and DMs. Right?
Yes. Thank
Thank
you.
you. Thank you for your time. Thank you, Vritti,
Thank
also
you.
for
Thank you
being
so
there.
much. Yeah,
Yeah.
thank you. It was really great. Thank you so much.
All the best,
Bye. Thank
Patti.
you.
Bye.
Yeah, thank you.